Okay, so my presentation is on tumor-to-tumor metastasis to Warthin tumor presenting as an initial sign of breast carcinoma. So just some background information, just because there are some big words in here that originally I didn't know what it was about. So I just wanted, I don't expect anyone else to know what these words are. So the first word is parotid gland. They are salivary glands that sit just in front of our ears. So right here, if you can see me, they make saliva to help with chewing, swallowing, and digesting food. Salivary gland tumors are abnormal cells that grow in the salivary gland or in the tubes that drain the gland. So yeah, not good, obviously. Another thing that we're focusing on is tumor-to-tumor metastasis. It's something rare. It's a rare phenomenon in which primary tumor cells metastasize hematogeneously. So that means that they spread to other parts of the body by blood into another tumor. So yeah. And then Warthin tumor is a type of tumor that only appears here. So benign neoplasm of the major salivary glands. And then something very important to note, what makes this case important is that tumor-to-tumor metastasis to salivary glands is very, extremely rare. So yeah, and I just wanted to show a visual representation of what this is. So you see here, this is the cancer cell or tumor. So the tumor, you slowly see particles of cancer cells part away. They enter through the bloodstream, and then here they're going through your blood circulation, and then arrest at a distant organ site. Then they get out and they have found a new place, and then metastatic colonization, and then there we go. There's tumors everywhere now. Well, I mean they just kind of get out. So yeah. So this case is focusing on a 69-year-old woman who has schizophrenia. She was referred to a clinic with a 2-month history of a mass on the left side of her neck. So yeah, there was some history is that she had no previous history of salivary gland problems or cancer. The patient had hypertension, which means that the pressure in your blood vessels is too high, and then the patient was a non-smoker. So when they took her to the clinic, they're like, okay, the first thing that we're gonna do is do a fine needle aspiration, so FNA. This is just they use a syringe with a needle, obviously, and they just kind of take out tissues themselves, and they examine them, and then they found out that it was a Warthin tumor. So in the next slide, you're gonna see just some X-ray scan. So the clinical examination revealed a 5 × 9 centimeter mass in her left pituitary gland. The cytology showed evidence of Warthin tumor. A contrast-enhanced CT scan of the neck showed a 3.6 × 2.8 × 4.5 centimeter tumor in the left parotid gland. A parotidectomy, which is a complete removal of the left pituitary gland, was performed. So yeah, here's the scan. So the first scan, this is just obviously her head or stuff like that. So here you see on the left side the Warthin tumor, and then here they have a picture, a CT scan from her neck. So yeah, right here is the tumor. So yeah, it's a just big ball right next to her face. So after this, they discovered that it originated from breast cancer. So yeah, pathology report revealed that the left pituitary gland tumor was a Warthin tumor containing 2 carcinoma metastasis. So carcinoma is when cancer is either from the skin or from the linings of organs. So yeah, and then metastasis, I kind of explained it earlier, where it enters the bloodstream and then it goes to other places. So yeah, the histomorphology and results from the immunohistochemical staining suggests that the primary tumor was likely to be a lobular carcinoma of the breast. So they found out that she had breast cancer. So they performed a mammography and breast ultrasound were performed. The image revealed a 10 by 6 by a centimeter tumor in the upper medial lobe of the right breast. The core biopsy showed that the tumor was a grade 2 lobular breast carcinoma with an ER 95%, PR 0%, HER2 negative, and a proliferation rate KI 67 of 14%. So the whole body CT scan and the whole body gamma scan showed bone metastasis. So what they did for this, the treatment that they followed was letrozole at 2.5 milligram and denosumab 120 milligram injection every 6 weeks and checkups with oncologists every 3 months. Now, 15 months after the treatment began, the patient is stable. Now, this article was posted in January of 2023, so I'm not sure how she's doing now. Some important parts that the article brought up, or the case study brought up, was that most salivary gland tumors occur in the parotid gland, so 70 to 81% of them. Most parotid glands are benign, but there are rare cases of the Warthin tumor. So Warthin tumor are very rare. Out of all the tumors that appear in the parotid glands, there are only 0.3% of them. So yeah. Distant primary metastasis of the parotid gland are very limited. Only 10 to 20% of parotid metastasis are from infraclavicular primary tumors. The most common distant primary tumor usually originate from the lungs, kidney, and breast. So yeah. According to the case study, the tumor-to-tumor metastasis is a very rare phenomenon. And what they were talking about is that there are very few cases of tumor of the salivary glands. And what's it called? What the publisher kept repeating, or the author of this article kept repeating, that this was like the first case of the salivary gland and breast cancer being affected, or both coming from the same place. So yeah, tumor-to-tumor metastasis to a Warthin tumor from breast cancer and sedona has not been previously published. So yeah, that's the rare part. Apparently it's one of the first written. So yeah. Palpitations or an ultrasound guided FNA is an important and distinguishing between benign and malignant tumors of the parotid gland. The FNA has moderate sensitivity, 78%, and a high specificity. But as with our patients, a negative FNA does not rule out malignant disease. Clinicians should always consider the possibility that a parotid gland tumor might be malignant despite a negative FNA. So the importance of this case is that the patient's case serves as a reminder that a new distant primary cancer might be the cause of a parotid gland.